Another theme from the story work with First Nations, Inuit, and Métis people is centered around what is heard when cancer is first spoken about and what is expected. The Dialogue and Story Work project used the brokered dialogue methodology. This approach unleashed the power of sharing stories to help facilitate safe, meaningful, and respectful conversations between healthcare professionals and Indigenous communities. Cancer survivors, those still on their cancer journey, and caregivers came forward with the support of community champions to share their personal stories and talk about the challenges and barriers they experienced when transitioning through different levels of care. Healthcare professionals then watched the narratives and responded on video, giving their professional opinions and thoughts on the issues and concerns shared. The healthcare professionals' video responses were then brought back to participants to continue the dialogue. Participants had an opportunity to respond on video to the healthcare professionals, in turn closing the loop on the dialogue in a way that was supportive and meaningful to each participant.
The very first time when the doctor told me that, I thought, no, can't be. I told him, you're not the boss. The one up there is the boss. But it's a scary, very scary thought, especially you're telling your kids and you're by yourself and your kids start crying and they start getting the mood change in them. At this time and moment, I'm not getting very much support or help from anyone or anybody. My family that I've known had went to a hospital and they passed away due to cancer, due to operation. And I need to know what's happening. I need my kids to know what's going to happen. I also told my brothers. Reason why that I did that was because my dad never told us. He never told us he had cancer. We lost him like that. We thought he was only getting a new incision for his cyst. Like the doctor said, oh, he'll be back up in 2-3 hours. It's only a new incision. And when he came back out, his whole lung was taken out. There were staples from his shoulder all the way to his back. There were staples, about 40, 50 staples. That was not middle. Nobody told us, no one told us, even the doctor never told us that it was for cancer. So that's a big impact. And then my uncles too. A couple of my uncles, they died of that too, cancer. And they said it was only a cyst. Then too, they get their lung removal.
So we talked to my dad. We didn't tell him he had cancer. We told him he was sick. And we told him, you have to be in the hospital till you get better. And then you can come home. So he said, okay. All this, and at one time, I went to the nursing station to get a refill for him. And then the nurse was looking at his chart, and then he said, oh, he was diagnosed in, I believe she said last year. And I said, I just looked at her, and what do you mean? He was diagnosed last year. And I looked at him, I said, what do you mean? I never knew my dad had cancer last year, I said. They only told us in April. I was kind of upset. I don't know why they didn't tell us that he had cancer before. It's today it's still like, I keep thinking maybe if I asked for his file, would they tell me? And then I keep thinking, why dig up something from the past?
started punching the walls, and this is not fair. And at that time, the nurse were trying to attend to me to calm me down. But they were supportive. What made it easier is that the whole family was there. We supported one another. The staff was good to us. But again, I wish I would have learned more about this cancer. I wish the physician at that time should have sat with us and talked to us instead of me just hearing it from him. The only thing I can say is that for that kind of diagnosis with cancer, like if it happens in a family, I believe that it's very important that the medical the medical people are there for supporting the family. I think this day and age is very important. I think the family members should be constantly be notified on the patient or the cancer patient.
Went down to my dad's grave yesterday. Talked to him to make me feel better. And today, this morning, I feel a lot better. I know he's watching over me. And I know he'll send me to the good people.
My parents never left my side, which also led to my own dad's business being let down because he never wanted to leave my side. We had no help from anywhere besides GHS, which helped us out very little, just enough to cover me and one other person to live there. And I was there for over 2 years, moving from place to place because we had no help. What little help came from our community was grateful. I appreciated it a lot.
So I think that one of the things that struck me when I was listening to her video was how much she experienced the fear of not knowing what was happening to her. And you know, from one step to the other, feeling that, again, she was possibly losing control on what was happening to her and causing her then a significant amount of fear of what was happening to her, basically, to her body. Fear for her family as well. Fear for not being able to be present for her son the way she used to be.
So the model of how we would approach patients for really any problem, but including a cancer diagnosis, is to really provide information. And so the first place that family and friends would be involved in is helping a patient receive and interpret that information, because often, you know, as soon as the word cancer is said, then nothing else is taken in that conversation. And then beyond that, really our job is to find out what the right approach is for that patient. And for most patients, frankly, there's a fairly straightforward path. You know, you have a cancer, we make the diagnosis, and there's a fairly straightforward prescribed treatment. Then there's some decisions about chemotherapy, radiation, adjunct treatments, and we try and help them negotiate those decisions as best as they can and we can, because they have obviously side effects that need to be taken into account. And so it's always balancing risk and benefit in anything we do.
What was also on her mind was her fear about going through colon cancer, and she had experience with family members who had suffered from that disease. And so when she noticed change in her bowel habits, she made sure she got checked. Fortunately, it all turned out well after the surgery, but it made her happy that she listened to her body and was proactive in getting things checked out.
I guess, you know, communicating, you have to do a lot of that in order to keep the patients aware of where they're going with their journey. Yeah? And that was the same thing I went through. It scares the daylights out of you, you know, like coming home. Just thinking about getting diagnosed with cancer still hurts.
Watching the videos of the patient, of the cancer survivor interviewees, I noticed there was a lot of uncertainty in their journey, and also the uncertainty when tests come back unequivocal and we're suspicious of a cancer, but you know there's nothing there yet, and there's long wait times in between, which for someone to have to live with over long periods of time it puts a lot of strain on their lives, and I can see ways in which we are in which we may not be providing that adequate sort of follow-up that people like that need.
We are so overwhelmed by delivering safe chemotherapy in this very intricate logistical process of systemic therapy delivery that we often don't have the time just to sit down and talk to people. I think one part of the project that really struck me is that we have to expand our capacity as caregivers to interact with our patients on a more comprehensive, holistic level. I do not think we should defer that to so-called psychosocial experts. I don't think we should defer that to Aboriginal liaison workers. I think we should take that on, and we should interact and be aware of the challenges that our Indigenous people are facing on a daily basis, and strengthen those ties and those communication channels to mitigate fear, mitigate the fear of authority figures, try to mitigate the long shadow of past horrors. And that's my message.
It's daunting. It's so daunting. I work in healthcare. I work in healthcare administration, and I know what people are going to go through. But to walk through it as an individual, as a person, it is overwhelming. No one person should be delivered the message of how they're going to die, how they're going to suffer on a piece of paper. We need care. We need people to sit down and talk about it. We need support groups. We need an advocate coming and saying, okay, these are the things that your family is going to go through. This is what you should expect. This is where you're going. And we can help you. A hand that reaches out to say, there's support, there's help.
This is the outcome of the story work with First Nations, Inuit, and Métis people in regards to what is heard when cancer is first spoken about and what is expected, along with the responses to the issues that were raised. From the story work, which issues stood out for you? Which issues stood out for you from the responses?